Waking up with us at Port Angeles this morning. I love looking out over the strait. Gorgeous morning here on a Friday. 8:12 is the time. The outbreak of COVID-19, previously known as the coronavirus, has created some real concern around the globe.
Yeah, and as the disease continues to spread, so does the fear surrounding it. And that fear has also had an unfortunate effect. So we have Matias Valenzuela, the Director of Equity and Social Justice for King County, and Teresita Batayola, the President and CEO of International Community Health Services, here this morning. Thank you so much. We want to talk about the efforts that you have made to combat stigmas that have really attached themselves to this outbreak. So thank you again for being here.
Yeah, what kind of stigma are we seeing out there right now?
Unfortunately, what we're seeing is that there's ignorance, and that where people are thinking that anybody who looks Asian might be carrying the coronavirus or COVID-19. But we've also felt the impact in the Chinatown International District, in Little Saigon, in Japantown, where attendance was down in terms of Lunar New Year. Restaurants are not as busy, stores are not as busy. And of course, we want people to know that it's safe. There is no threat of an outbreak in our community, and definitely not present at this time.
And what are the signals that you're getting that that is the case, that this is about discrimination, or I should say bias, or however you phrase it?
It ranges anywhere from inappropriate comments. I know that my daughter's friend took an Uber just the other day, and the driver looked at her and said, "You're Chinese." It's if, you know, don't come into my car. And so her friend very quickly corrected the Uber driver and said, "No, I'm not. I'm from here." But still, you know, an inappropriate comment like that leads to, you know, basically confirmation that there's fear. That's the fear that is unfounded.
Right. It's disturbing, Matias, isn't it?
Yeah, I mean, one of the things that we're trying to, through our public health department, King County, been looking at, there are no cases right now, really, so the risk to the general public is very low, and there's no transmission happening in the community. So just staying informed, getting the right information is critical, and this is a time when we need people to actually come together to support each other, and I think kind of the first kind of casualty of this now is discrimination and hate and just division, and that's the last thing we want to see.
What do you think people should do, though? Look, what kind of tools should people put in their own resource toolbox? You know, like, you know, your daughter's friends who corrected someone. But what other things can you do? Because we've seen some, maybe some Chinese language schools kind of go in panic mode, or we've seen other Lunar New Year celebrations cancel altogether. I mean, should we rise up and say, okay, let's not cancel this, let's not do this? Or, I mean, what kind of tools can people have in their everyday life?
Right now, we're not recommending anything to be canceled, so people should actually be acting normally. So that's where you think a lot of harm is happening by misinformation. So people should go around and act normally. It is flu season, so take your usual precautions in terms of washing your hands, covering your cough, staying home when sick, and doing those kinds of things. But in terms of activities, really discrimination, bias don't have a place in our community. So there's people can actually, you know, City of Seattle, King County, State of Washington, we all have civil rights offices. School districts have civil rights offices too. So really, if there are incidences, they should be reported, so we are able to respond to them appropriately.
That's exactly what I was just going to ask. I mean, if someone does feel like they're discriminated against, what is it that they should be doing? So there are resources for that.
There are resources also in terms of businesses, in terms of housing, in terms of public accommodation. You can't discriminate against people based on their race, their national origin, their ethnicity, their gender. So it's important to people to know that they actually have some recourse.
But I would add that our region is generally very accepting and embracing of diversity. So for those folks who really know and know the facts and follow the story, come to the International District. Come and enjoy our services. You know, eat wonderful food, great prices. That's the way to support us, and that's the way to educate people that there is nothing wrong going on in our community.
Yeah, what's coming up? Give us a quick preview. Tell us a good event to show up to.
Well, you know, there are still a lot of Lunar and New Year celebrations. Of course, the Wing Luke Museum always has fascinating exhibits, including one of Bruce Lee. But I will say, come to our clinic too. International Community Health Services is there to help. And we have been participating with public health and making sure that when people call us, we provide the right information. If they need our services, they can come in.
Yeah.
Fantastic.
Well, thank you so much for spending part of your morning with us. I think it's a great education piece.
Yeah.
I've had,
Yeah.
some personal encounters with people that I'm just very shocked that
Yeah.
it's happening.
Yeah.
So,
Yeah.
Yeah.
I know that.
Yeah.
Thanks, you two. Appreciate
Thank
it.
you.
Thank you so
Appreciate it.
much.
thank you.
Let's get to